Module 13, Long-Term Care Patient/Residents, Part 2. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Hello, CNA students. Let's be honest. Module 13 is a giant module with 290 vocabulary terms. In order to study and understand Module 13 effectively, we need to understand that the vocabulary terms are well organized into specific parts and systems. To help you, we now have broken down Module 13 into 4 distinctive parts. For Module 13, Part 2, we are studying the immune system, the cardiovascular system, and the integumentary system. 2. Immune system. What it is, the body's defense system that fights disease and infection. Main function, protects the body from germs, viruses, and harmful substances. Key parts. White blood cells fight infections. Lymph nodes filter harmful substances. Spleen removes old blood cells and fights infection. Bone marrow makes new blood cells. Important for CNAs. Use proper infection control, hand washing, gloves. Watch for signs of infection, fever, redness, swelling. Some patients have weak immune systems and get sick easily. 3. Cardiovascular system. What it is, the system that pumps blood throughout the body. Main function, delivers oxygen and nutrients to all body parts and removes waste. Key parts. Heart pumps blood through the body. Blood vessels. Arteries carry blood away from the heart. Veins carry blood back to the heart. Capillaries, tiny vessels that connect arteries and veins. Blood carries oxygen, nutrients, and waste. Important for CNAs. Take vital signs, blood pressure, pulse. Watch for chest pain, shortness of breath, swelling in legs. Help patients with heart conditions avoid overexertion. 4. Integumentary system. What it is, the skin and everything attached to it. Main function, protects the body from injury, infection, and temperature changes. Key parts. Skin, the body's largest organ. Hair helps regulate body temperature. Nails protect fingers and toes. Sweat glands help cool the body. Oil glands keep skin moist. Important for CNAs. Check skin daily for pressure sores. bed sores. Keep skin clean and dry. Report any cuts, bruises, rashes, or skin changes. Help prevent skin breakdown by turning bedridden patients. Okay, now get ready to learn by pronouncing each of the following vocabulary terms, as well as listening to the sentences for each term in context. Are you ready? Okay, let's do this.
Module 13, Long-Term Care Patient Resident, Part 2. The purpose of this unit is to introduce the student to the basic structure of the body and to review the effect of aging on body structure and function. Common physical and psychological conditions found in elderly patients are presented along with approaches to care. Community resources commonly available to assist elderly patients with their psychological, recreational, and social needs are presented. Performance standards, objectives, define key terminology. Immune system. 84 antibody. 85 antigen. 86 autoimmunodeficiency syndrome, AIDS. 87 carrier. 88 human immunodeficiency virus. 89 immunity. 90 lymph node. 91 T cell. 92 white blood cell. Cardiovascular system. 93 anemia. 94 angina. 95 anti-embolic stockings. 96 artery. 97 atherosclerosis. 98 blood. 99 capillary. 100 congestive heart failure, CHF. 101 coronary artery disease. 102 dyspnea. 103 edema. 104 embolism. 105 heart. 106 hypertension. 107 hypoxia. 108 ischemia. 109 myocardial infarction. 110 orthopnea. 111 pacemaker. 112 peripheral vascular disease, PVD. 113 phlebitis. 114 pulmonary edema. 115 sequential compression device, SCD. 116 systole. 117 thrombus. 118 varicose vein. 119 vein. 120 vessel. Integumentary system. 121 abrasion. 122 allergies. 123 bony prominences. 124 cyanotic. 125 debris. 126 decubitus ulcer. 127 dermis. 128 epidermis, 129 excoriation, 130 friction, 131 gangrene, 132 hematoma, 133 lesion, 134 necrosis, 135 pallor, 136 pediculosis, 137 pressure ulcer, 138 pruritus, 139 psoriasis, 140 scabies, 141 shearing, 142 skin, 143 skin tears. CNA California Exam Vocabulary Sentences for Module 13. Immune system terms. An antibody is a protein that fights infections in the blood. An antigen is a substance that triggers the immune system to respond. Autoimmunodeficiency syndrome, AIDS, severely weakens the body's immune system. A carrier has an infectious disease but shows no symptoms. Human immunodeficiency virus, HIV, attacks the immune system and can lead to AIDS. Immunity is the body's ability to resist infection and disease. Lymph nodes filter harmful substances and contain infection-fighting cells. T cells are white blood cells that play a key role in immune responses. White blood cells defend the body against infections and foreign materials. Cardiovascular system terms. Anemia occurs when the body doesn't have enough healthy red blood cells. Angina is chest pain caused by reduced blood flow to the heart. Anti-embolic stockings prevent blood clots by promoting circulation in the legs. An artery carries oxygen-rich blood away from the heart to body tissues. Atherosclerosis occurs when fatty deposits narrow the arteries. Blood carries oxygen, nutrients, and waste products throughout the body. Capillaries are the smallest blood vessels where oxygen and nutrients are exchanged. Congestive heart failure, CHF, means the heart cannot pump blood effectively. Coronary artery disease reduces blood supply to the heart muscle. Dyspnea is difficulty breathing or shortness of breath. Edema is swelling caused by excess fluid in body tissues. An embolism occurs when a blood clot blocks a blood vessel. The heart pumps blood throughout the body continuously. Hypertension means blood pressure is consistently too high. Hypoxia is a lack of adequate oxygen in body tissues. Ischemia occurs when blood flow to body tissues is reduced. A myocardial infarction is a heart attack caused by blocked coronary arteries. Orthopnea means breathing is easier when sitting or standing upright. A pacemaker regulates the heart's rhythm and rate. Peripheral vascular disease, PVD, affects blood circulation in arms and legs. Phlebitis is inflammation of a blood vessel, usually a vein. Pulmonary edema is dangerous fluid accumulation in the lungs. A sequential compression device, SCD, prevents blood clots in the legs. Systole is when the heart contracts to pump blood out. A thrombus is a blood clot that forms inside a blood vessel. Varicose veins are swollen, twisted veins usually seen in the legs. A vein carries blood back to the heart from body tissues. A vessel is any tube that carries blood through the body. Integumentary system terms: an abrasion is a scrape or scratch on the skin surface. Allergies cause abnormal reactions to normally harmless substances. Bony prominences are areas where bones are close to the skin surface. Cyanotic skin appears blue due to lack of oxygen. To debride means to remove dead tissue from a wound. A decubitous ulcer is a pressure sore that develops from prolonged bed rest. The dermis is the thick middle layer of skin. The epidermis is the thin outer layer of skin. Excoriation is skin irritation caused by scratching or rubbing. Friction occurs when two surfaces rub against each other. Gangrene is tissue death due to lack of blood supply. A hematoma is a localized collection of blood under the skin. A lesion is any abnormal change in skin tissue. Necrosis is the death of cells or tissue. Pallor is unusual paleness of the skin. Pediculosis is an infestation of lice on the body or scalp. A pressure ulcer develops when constant pressure cuts off blood flow to skin. Pruritus is severe itching of the skin. Psoriasis causes red, scaly patches on the skin. Scabies is a contagious skin condition caused by tiny mites. Shearing occurs when skin moves in one direction while underlying tissue moves another way. Skin is the body's largest organ and provides protection from the environment. Skin tears are wounds where the top layer of skin is partially or completely separated.